the Global Health Matters podcast. I'm your host, Dr. Garry Aslanyan. I'm excited to launch our 5th season, a season filled with timely and thought-provoking conversations on global health. To date, we have produced more than 60 episodes, and I'm encouraging you to explore our archives. And if you haven't yet, follow or subscribe wherever you get your podcasts so new episodes land straight in your feed. Our theme this brand new season is the future of global health. In a time of turbulence, transition, and transformation, we need diverse voices to help shape what comes next. For this first episode, I'm joined by two insightful thought leaders, Paola Abril Campos Rivera, research professor in health policy at Tecnológico de Monterrey in Mexico, and Catherine Kyobutungi, executive director of the African Population and Health Research Center based in Kenya. Together, we explore how global health is being reshaped amid shifting geopolitics, declining aid, and the rapid rise of new technologies. Hi, Abril. Catherine? How are you today?
Hi, Garry. Good, thank you.
Hi, Garry.
So let's get started. This is a very good and interesting conversation and really timely. Before we dive into the actual topic, what do you think of and how do you understand the terminology and the term global health, what it is and what it's not for you? Whoever wants to go first.
That's a very good question. I would prefer to answer what should be. Because what it is, it depends, right? So, but what should be, I think it should be a network of actors, norms, processes, funding flows that have a specific aim. At the basic level, it should be improving the health of the global population, right?
I think I'll add on what Abril has said that there's what it's supposed to be and there's what it is or what it has become. And at the most basic level, when you think when you look at definitions of global health, there's health equity in there, and there's health equity for all people worldwide. And then, of course, there are some specific roles which global health is supposed to address around things that transcend national borders. But then also in there, the fact that global health as a field should address structural injustices, social determinants, and then things like global threats. So that is the ideal, what global health should be. But as somebody who came into this field not so long ago, what it is and what it has become is that thing that, from where I see it, powerful people and institutions do to and for people in less powerful and wealthy countries. So that's how you see global health. It's like that thing which people from somewhere think about and conceptualize and then do. And then those, for us in parts of the world, we receive some kind of benevolence from this whole system that exists. So that is how I understand global health. For me, it's that thing which is there and people come and do to us. And they keep doing.
Is it okay if I just make a comment based on the last response? Because that really got me thinking. I was thinking about my own career and how, Catherine, you talk a lot about mental models, right? And I'm from Mexico, of course. I studied in the US, and my first job was working on community health programs in low-income populations in the US. So to me, that was global health. I was not in my country, and I was improving the health of populations. But of course, people didn't call that. Then I had the opportunity to go to Ghana, and that's what they called that's global health. And to me, that's interesting, right? And then everyone there was doing global health. And then I came back to my country and worked for the government. And I was like, well, I'm not doing global health. I'm from Mexico and I'm improving my own health system. But then people again would call it perhaps global health. So you are right that it starts from how we get educated and who gets to say what's global health or not. And I was thinking about, in a new global health system, I think the topics should be different. I think, previously, because of these roots in colonization, etc., global health was, supporting an HIV program in a global south country. That was global health or you name it, right? But I think now we really need to think about what are the topics that need collective action at the global level. And in my proposal, I say, well, I mean, issues like planetary health, how do we, achieve that, or addressing climate change, or commercial determinants of health that require really a global perspective, because trade policies, etc., get decided at the global level. So I think we really need to be pushing and advocating for these are the new topics of global health that really impact us all, and etc. So just wanted to share that. You really got me thinking, Catherine. Thanks.
Well, this is very good, and I appreciate it. And I think our audience will also reflect now with your input. So in this time where we are in global health, the way we understand it, from your regional or country, obviously your experience, what do you see as the two biggest challenges holding global health back today as we see it, and also two most promising opportunities for shaping its future? Abril, you want to go first?
Sure. Global health, as Catherine was saying, it's perceived in very different ways. I don't think there's been a global consensus of what global health is or should achieve. So this kind of unclear unclear framework around global health, I think it's a first challenge, and not just framework, but perhaps consensus, an inclusive consensus about what is and what should achieve. It's a first challenge. The second challenge, I think, is being more focused, So that lack of focus, perhaps, and lack of ethical imperative, I think that Catherine was alluding to, right? I think in a new global health system, we should have a strengthened ethical imperative, or stronger ethical imperative.
And ideas for future?
I think reaching some sort of common understanding, agreement, consensus, where many voices are included. I mean, all voices ideal, but we know that's hard, but with many voices say, well, this is what we want to achieve, and then I think rebalancing the scales, I think not always having the same people saying what should be done or what should we achieve, but having more people and having stronger commitment and accountability. So some sort of checks and balances.
Okay. Catherine, what are your thoughts?
What I see as the biggest challenge is the system that sort of gives us these power differentials that we have in global health. And the fact that these power differentials have existed for a very long time. And there are some systems that actually enhance and reinforce and entrench these differentials. So when you think about reform of global health, it's not just reforming the global health as an isolated system. It's about the other systems that entrench these power differentials, within the actors in global health. So these power systems are entrenched through education. Our education system, if you are in the global north and in the global south, and you're studying global health, I studied in Germany, and you're already socialized to accept that my continent has problems and has weak systems and doesn't have capacity. You're socialized, even as somebody who's trained at that high level, I'm already socialized that way. Our politicians are socialized that way. And then, of course, the people in the global north are socialized to think that they have the solutions and they have the power to solve problems. So this is the education system entrenches power differentials. And so if we are to think about reform, it can't just say let's reform, the global health initiatives and all this. There are many things you have to think about reforming. And that is not easy, because these are very powerful systems to reclaim our agency and see ourselves as having the power and the means and the tools and the expertise and the knowledge to solve our problems, and not to always look somewhere for solutions. So for me, that's a big challenge. And then, of course, for the players in the global north is to say, are they willing to cede power? Do they realize that actually some of the actions that we see in global health are a power trip? And they need to step back and say, I'm doing global health because I see equity at the end. I see justice at the end. And I'm not doing global health because I've built a profile and I have certain kind of expertise and I'm powerful and important. Now, of course, when it comes to opportunities, this moment is an opportunity, actually. The disruption is an opportunity. It's a crisis. And I think the crisis can be debilitating, but they can also be harnessed and leveraged to rethink, because there are things we never thought were possible. Now they are possible because of this whole disruption that we have. And so we can look at that as an opportunity. But of course, other than that, there are many other things which are happening in the world. The rapid advancements in data science, in AI, in all these things. The question is whether we are preparing the ground for us to be able to harness this power. But I don't think the window to do that is still open. So if we do the right things now, we actually might find ourselves having leapfrogged a lot of things that we're going to take decades to build when it comes to, for instance, knowledge systems and how knowledge is translated.
So for our conversation, I'd like us to dive deeper into some of these challenges and opportunities. So you already mentioned some of them, but let's focus on the role of power and decision-making. It's a constant one that comes up. You did mention how we leverage the technology and AI. And also, if we can, let's also look at the unlocking of new kind of financial streams and financial sources. So if we look at that, you've given a lot of thought into this, and you actually looked at how the global health system can be reformed. You had a contribution made to the work commissioned by Wellcome. So if we start maybe, Abril, with you, one of these areas that you were proposing to reform on power and decision-making is in terms of shifting the values beyond equity toward what you called in your submission as health justice. Maybe you can explain what you mean by health justice and how you imagine it being put into practice.
So I chose to speak about health justice and not just health equity, because exactly what we were just discussing, the issue of power and how it manifests in different areas of global health cooperation. It can be production of knowledge, it can be technical assistance, it can be decision-making around who gets money, etc. So global health with justice demands more than technical cooperation to achieve equity in health results. It requires really thinking about how are we going to have mechanisms that ensure fairness in the design of governance mechanisms, for example. How are we going to make sure that we correct historical imbalances about, for example, where knowledge or expertise is produced and why? Again, alluding to what Catherine was saying, why do we look to the north to get advice about what should we do with our health systems, right? I mean, that's changed. And in our region, I think we had the opportunity to have, a lot of people trained in the north and then come back and produce their own knowledge. But I think there's still that. So I thought that health justice was more appropriate because it really required going deeper into the structures that sustain this unequal global health system and not just focusing on equity in health results.
There's a little bit of focus on regional approaches to that in your thinking. And whether or not you think that regional approach in decision-making is possible for all kinds of regions. I don't want to challenge, but I think it's a generalization, but maybe you can convince me otherwise.
Well, I'm not sure, Garry, because I even think for our region, it's not that easy. I've talked to different people from our region and they said, Abril, the problem is there's no identity. There's no regional identity. Why would, a citizen in Argentina say, sure, send a percentage of my tax contribution to support, someone in Costa Rica or someone in Honduras, right? It's not that clear how would we achieve that. And I mean, if we're talking about redistribution mechanisms to redistribute funds within the region. So I think it's hard even for our region. And now we have two options. We say, well, let's be very pragmatic and think about the geopolitical context of our time and see what we can improve on the margin. Or exactly because of that, why don't we become that voice that is, talking about something quite ambitious, perhaps not politically feasible at the moment, but that we think would help improve, population health in our region. So I think it's an option to decentralize power and have more authority at the regional level to produce knowledge, to provide technical assistance, to raise funds for health, I think it will require political analysis to improve the feasibility of this proposal.
Okay, interesting. Catherine, you've been strong advocate calling for decolonization and African health systems, African institutions. In fact, on this very podcast, you were part of the discussion a couple of years ago, and congratulations on being the second-time guest ever. So you're joining a club of very few so far. So how has this language of decolonization, or the phenomena, I don't even know how to call it, in the recent years that we all been really discussing, helped African nations so far? And what opportunities as well as limitations do you see in this concept as a driver for future reform?
I'm not sure about how far the language has helped, especially within African nations. Because again, like many things, the debates around decolonization of global health are sort of limited either in academic circles and mostly academic circles in the global north. But having said that, the same issue can be problematized differently. So people may not talk about decolonization. And I'll just give an example. In the recent past, after everything that has been happening in this whole seismic geopolitical shifts, especially in the funding landscape, there's such a dichotomy between the reactions in the global south, at least from the African continent, and the reactions in the global north, especially in the US. And the overwhelming reaction on the African continent is about how this is a huge opportunity. The reactions revolve around the themes of sovereignty and breaking the shackles of aid dependency. So almost every commentary, whether it is, and even ordinary people reacting, it's been about finally, this is an opportunity for us to break the shackles of dependency. So the themes of sovereignty and breaking dependency have been thrown around, and they are sort of like maybe one of the commonest themes that people are talking about. Now, when you think about those themes, they are not far from the aims of decolonization. So people may not necessarily call it decolonization, but what they are talking about is actually an outcome of a decolonized global health system. So it's that this is language especially from an African perspective, may not be mainstream. And so when I think about some of the proposals I'm making, I've said when you think about global health and these three pillars, you have a pillar in education, you have a pillar in research, and you have a pillar in practice. And those pillars sort of interconnected. People who end up being practitioners in global health, whether they sit in multilateral organizations, whether they sit in the international NGOs, whether they sit in the global health initiatives, are trained in schools of global health, or what used to be international health or schools of public health a few years back. And so there's a pipeline that ends up into the practice, and there's a pipeline that ends up in research. And so if we are to reform, we can't reform without reforming what happens in the education system. And I think one of the proposals I'm making is that we need to have the current curricula for global health to be reviewed so that there's an explicit acknowledgement of the colonial roots of colonialism, but also there's an explicit intention of proposing how do we get out of this? How do we create agency? How do we center dignity? How do we center agency? How do we center independence? So I still think the framework of decolonized global health is still relevant, and it will be, I think, a big part of any kind of reform that we aspire to. Some people don't want to say the word, so they call it all sorts of things. But at the end of the day, I think we are all moving in the same direction, that we want to see equity, we want to see justice, and we want to see the dismantling of structures that give us inequity and injustice.
Catherine's last point captures it well. The crisis can also be seen as an opportunity, even if it's not always called decolonization. The key is naming these dynamics and making sure public health professionals engage with them. Let's shift to financing. With global health funding in decline, how can countries move toward greater reliance on domestic resources? Abril, let's start with you.
domestic resource mobilization will be key. So I said, yes, we're going to push for greater domestic resource mobilization, but we also need to make sure that the global financing architecture is fair. And there are, different proposals not put forward by me, but by others who are more experts than me on this topic. But for example, the Bridgetown Initiative that, came out from the Caribbean saying, well, we need fairer terms in terms of borrowing money, and having, these climate crisis funds, vulnerability funds, etc. So I think global health professionals, academics, etc., we need to engage with those discussions, outside global health, because we care about a fair financing system, because that's where the money will come. On the other hand, I proposed other types of sources, such as regional sin tax, and I think taxes that I think others have also proposed as an option. But I know also that taxes is always kind of like this, it's seen as a silver bullet, but it's very hard to adopt politically. But I think we should explore those sources as well.
What about you, Catherine? What are your ideas around financing and the future when it comes to how we fund some of these things?
I think I look at it from several perspectives. One is the actual money, and then the second is what the money is used for. Surprisingly, I don't have the full data right now, but all signs are that most African countries have increased their health budget this year. Most of them. I've only found Mozambique so far that has cut the health budget for 2025-2026. And that was done after all these things happened in January, because most budgets were being finalized and approved around May, June. So almost all African countries have increased their health budget. Where did the money come from? Uganda has doubled its health budget, doubled. Of course, part of it is still funded from external sources, but they've doubled the health budget, which means the domestic contribution probably is going to double from what it was last year. So I think it's one of those things when I talk about dependency that, in my mind, I think our politicians were looking at, you have a problem in your house and somebody said, I'm going to solve it for you. I'll say, okay, so you do other things. That's why they can afford all these things which don't add value to the common man on the street, because somebody was taking care of what should be their problem. Now, if somebody is not taking care of that problem, I don't think they're going to keep being this extravagant when there are people who need ARVs or people who need all this stuff. So they may not cover everything that was taken off the table, but it is within the means of most African countries to actually improve their health financing. So that's the first point. The second point, let's talk about efficiency. How the aid-dependent health systems operate, how they create inefficiencies, how they create duplication. Part of it is wastage directly. You have a procurement system for PEPFAR, you have a procurement system for Global Fund, and then you have a government procurement system. So if it's possible that you can actually achieve the same health outcomes by being more efficient, you collapse all these systems. Have the Global Fund should use the national system for procurement. Why do you need a separate system for Global Fund? PEPFAR should use the same national system. If it's not good enough, let's invest in a system that is good enough for everybody. But let's not keep on duplicating all these parallel systems. So you can actually achieve efficiencies with reduced resources, because not all the money was going to ARVs. Some of it was going to procurement system and data systems and training programs that are being duplicated all over the place. And then, of course, the longer term perspective is how do you strengthen the whole system so we start producing health. For 20 years, we've been dealing with diseases and not investing in systems that produce health. So again, you can look at 10 years down the line, 5 years down the line. If you invest in producing health, actually you'll have health gains. Then you don't need all this money that you need now. But if you don't invest in health production, of course, then there will be always a shortage of money because we are degenerating diseases instead of producing health. So there are many things that could be said, but I don't buy into the argument that, oh my God, this is catastrophic. If we create the right systems and incentives now in the next few years and invest in systems that are going to produce health in the long term, I don't think we'll be too concerned about where this money is going to come from.
So many of our listeners are people like us, more or less, people who work in public health. And what would they be able to do? What kind of demands themselves as health practitioners, or when they are talking to people, citizens of countries where they are, what would they ask the governments to do to ensure that health systems are properly financed, especially in light of all of these comments you made, that sometimes it's not a lack of money, but it's how it's organized. What would be your advice? Abril, you want to start, and then Catherine?
I love this question, Gary. I mean, I think that we have more responsibility than ever to keep advocating, to first address the social and economic conditions that shape health. I think what Catherine was saying, right? We've been focusing on disease and we haven't focused on how health is generated or harmed by these social and economic conditions. I think that's one thing. The second one is about, it's hard given the political context of many countries, but focusing on information and data and finding smarter ways to leverage improvements in technology to provide more timely data at the point of decision making to make sure that priorities are informed by this data. And third, I think, I'm hopeful about the field of commercial determinants of health, because it's a way of putting emphasis or keeping the focus on these like economic and social factors that shape health. And I think we need to retrain ourselves. I mean, for me, it has entailed to keep learning and retool myself to really understand how these, trade policies, economic policies affect health, and how we need to keep advocating for a change in those policies. I think that's a must when we see the burden of disease, at least in countries like Mexico, with diet-related diseases, diabetes, etc. And we need to keep talking to people in other disciplines and working with other ministries. We've said this in the past, but right, if we're not talking to the Ministry of Finance, I mean, we have no future. Those would be my suggestions.
Okay, Catherine, what do you think?
Yeah, I mean, I think I want to go back to the point that Abril made about how difficult it is to have this regional approach and the regional outlook. And when I look at our political class, especially on the African continent, I think they think the world that existed 10 years ago still exists. And I don't think they've woken up to the fact that we live in a completely different world where almost everybody is looking inwards. Everybody's looking inwards. And that is, I think, maybe the most innocuous, that people are looking inwards. There are much more dangerous things happening around how certain sort of ideologies are coming together. And if I was an African president, I would be concerned about even my future as a continent or as a country, as a president, because of several things which are happening, because certain forces are coming together. But the Africans, we're still 54 states and we're all, there in our little cocoons, doing certain things. And we still think that the world where we can say, we're very poor, give us money, that world is gone, and likely to come back. So it's inevitable, or it is necessary, that we come together as a region, as Africans, as a bloc, for certain things, not everything. We have our own nuances and our own unique things, but we need to come together as a bloc. I think it's like we need to impress it upon our leaders that we need to have certain thinking about our Africanness as an identity, that we need to come together and see the power that exists in that identity. Now, within countries, there are many things. Again, I think there are times that I want to shake people. I said, do you realize how much power you have? We need to force people to see the kind of power that they have and to stop thinking that our problems can be outsourced to others to solve. That's the second thing. Now, the last thing I would say is we need to think about systems. I believe just talk about data systems. It's the whole knowledge system. The fact that we've outsourced the knowledge system as Africans to the rest of the world, we need to build our own knowledge system, not from an indigenous knowledge perspective, but also our data systems, our own research. We need to invest in research institutions. We need to invest in academia. We need to see how to connect what is done and how we make decisions. There are many things. And then, of course, the rest is about some of the specific proposals I made, coming back to the basics. What is primary health care? Why did we put primary health care aside? And we've been running around doing all sorts of things, everything but primary health care. We need to invest in systems that are going to produce results maybe 5 years or 10 years down the line, because no one is going to do it. If we are obsessed with 5-year election cycles and we don't see that things we do today will have impact 10 years from now, I don't know, 10 years we may not even exist. I've said we might be recolonized, and I don't think it's far-fetched at the rate the world is going. It's not unfathomable that 15 years from now, our country start getting recolonized. It's not unfathomable because we live in an interesting time, and not interesting, not in a good way. And I think our African political class needs to wake up to that fact.
You both mentioned how the technological change is really with us, and particularly AI. And we've had a discussion about AI's potential in improving health quality, efficiency, and it has its own challenges when it comes to equity. How does the integration of AI actually happen, and what are your thoughts about this topic in terms of the future? Who wants to go? Catherine, you want to go first, and then Abril?
AI and health systems or healthcare. So I think from where I sit, this is not really a space that I occupy, but as a research and policy organization, we actually have a program of work around data science. And when we put up this program of work, we came up with a strategy, and the strategy is focused actually on building the underlying infrastructure and ecosystem, not necessarily on building capabilities for analytics. Because a lot of trends come and they fly over Africa. A few people see and they wave at these trends that is flying over because the underlying ecosystem is very weak. The data ecosystem is weak, whether it's from a regulatory perspective. There's work that shows how many countries don't even have data protection laws. There's a paper that shows how disparate those data protection laws are. So if you don't have data protection laws, how do you harness AI with all these things about ethics and all that stuff? So we live in a very weak ecosystem that is not ready to harness the full potential of AI. And there's also, of course, the cultural and other social factors. Our political class is of a different generation. Our academic class, the leadership, is of a different generation. There's a generational gap between what AI could do and the people who are making decisions about their whole understanding of what AI could do. So in the last, I would say, 3 months, we've had large-scale training, 250 plus members of parliament from different parts of the continent, sitting in a 3-hour session, really trying to understand what is AI, what is possible, what is my role as a legislator. So that is the ecosystem in which we are, that even our parliamentarians, their understanding of AI and their role is still a little bit far. So we still need to do a lot and then see what comes. Hopefully we'll catch up with the rest of the world maybe in the next year or so. But I don't think for now the continent is ready really to harness the full potential of AI.
Well, okay, it's good to recognize these things. So these are good reflection. These things are not equal. And that's what we learned from that discussion as well. Abril, where you are, what's happening in Mexico?
Yeah, well, I have to say, so my research center is at a school of government with a strong focus on data science and AI. So we have actually a center on AI, and then we have the School of Engineering where there's an initiative on AI. So I've been able to learn quite a bit and see some of the applications. So I'm quite excited about some of the results that we've gotten. I'll give you an example. Very recently, we organized a symposium on food systems, so bringing together the Ministry of Agriculture, Health, academics, FAO, WHO, UNICEF. And what we did is we sent an AI agent to interview all participants before the symposium to get their ideas, what were their priorities, what were the challenges. So before the symposium, we had this 200-page report about what each stakeholder thought about the transformation in Mexico, and we were able to map, points of consensus, points of tension, and we sent all participants beforehand a report. These are the different groups. And then during the symposium, we of course organized working groups based on these, and to me that was it allows to be more productive and facilitates the human interaction. So sometimes in these reunions or these meetings, it's hard to get to consensus. So now I'm using it again, and I see that as a really good application in terms of a good collaboration between human and artificial intelligence. I think it can make processes faster. I think I'm more excited about the potential of improving collaboration and human-to-human interaction with AI. So that's one application I can talk about and that excites me about this technology.
As we come to the conclusion of our discussion, I'm sending you on an elevator, and it's about 8 floors. And someone says that whatever you say in that elevator is going to be how it's going to be. And this is really to help our listeners to learn from how you do it. What is your vision for future global health, and what message you'd leave with our listeners in that 8th floor elevator trip and encourage them for hope in the future? Catherine, you go.
I think one thing I would first say is that the current moment is not a catastrophe. The current moment is a huge, unprecedented opportunity for reform, and we should see it that way. And if we focus our energies on the opportunity and not the catastrophe, and we put off the lens of catastrophizing, we might actually see a global health system in future that serves us better, maybe even with the same resources. That's the first thing I would say. Now, when I think about the global health system of the future, for me, I see a system where, from an African perspective, if I take one country, I come from Uganda, I see where the Ministry of Health is facilitated and prioritizes. It sits down and on a regular basis can review what is going on in the country and say, this is the problem we have, and this is how we're going to go about this problem. 3 years later, they review again and say, we have a different problem. This is how we're going to go about it. But underpinning all that is actually global health focuses on building systems and not dealing with few problems that are never going to be resolved unless the system themselves are fixed. So I see a system approach, and I see a system that is driven from the bottom, from the ground up, and not a system that is imposed on our people. Yeah, so that's the future.
Thank you. Abril, you are on that elevator too.
Okay, so I would say that imagine global health is a playing field that is leveled. It's an arena where actors from countries, but not only government, but other sectors like civil society, we come together to fix economic and social injustices that shape health. So we get together, we define a common aspiration, we set up a timeline, and we work on time-bound missions to fix, for example, trade policies that are affecting health in many countries, or, for example, transnational laws that affect how corporations work in different countries. So it's an arena that enables cooperation, solidarity, and that it's really focused on addressing injustices in economic and social structures that affect the global population.
Okay, I really enjoyed this conversation. Thank you, both of you. Let's wrap it up here. I look forward to seeing you in this next few years as this whole thing unfolds, but I'm honestly more hopeful than I was before we started the recording.
Thank you, Garry.
Thank you very much, Garry. And thank you, Catherine.
Thank you, Abril.
I found the conversation with Abril and Catherine thoroughly stimulating. 3 key messages stand out for me as guideposts for the future of global health. First, global health must confront power imbalances, whether in education, decision-making, or financing, if it's to achieve real equity and health justice. Second, financing reform is essential. As international aid declines, all of us need to play a role locally and globally, encouraging innovative mobilization of domestic resources and improving efficiency, while also advocating for fairer global economic rules. And finally, disruption is also an opportunity. From AI to new regional approaches, today's challenges can become catalysts for bold reform if we seize them with vision and courage. I hope this episode leaves you with renewed energy for the work ahead. Before we finish, let's hear from one of our listeners.
Hi, Garry. It's Krista from Canada here. I have been an avid listener to the Global Health Matters podcast since its inception. In fact, I listened to the episodes of the show obsessively when I was returning to work after each of my 2 extended parental leaves. After those leaves, the podcast helped bring me up to speed on the what's what in global health. With 2 toddlers running around, I had no time to sit down and immerse myself in the global health literature, and the podcasts were a great supplement. It enabled me to refamiliarize myself with key thinkers and debates in this space, while also finishing up household tasks like doing the dishes and sometimes even changing diapers. I continue to listen to this podcast out of pure interest and also because it helps keep me engaged and in the know in my professional life. Thanks so much, Garry. Keep it up.
Thank you for your message, Krista. I'm so pleased Global Health Matters helps you stay connected professionally while doing the important work of parenting. To learn more about the topic discussed in this episode, visit the episode's webpage where you will find additional readings, show notes, and translations. Don't forget to get in touch with us via social media, email, or by sharing a voice message. And be sure to subscribe or follow us wherever you get your podcasts. Global Health Matters is produced by TDR, a United Nations co-sponsored research program based at the World Health Organization. Thank you for listening.